Hi guys. It's been a rough couple of days. I got into an accident last week, so I haven't been around. I wanted to talk to you guys today in reference to the symptoms of ovarian cancer. I'm trying to fix my little ribbon here, and it doesn't want to go into place. So the symptoms, as a lot of people say, mimic a lot of other things that's going on, other diseases. So in ovarian cancer, it's very hard to detect in an early stage. So that's why it's more common where someone is in their second, third, or sometimes even fourth. Now, I know you've probably seen my posts on the symptoms and everything, but I wanted to kind of just talk to you a little bit about a few of them. For instance, bloating. I can kind of guarantee that 90% of women feel bloated. It's either the foods that they eat or anything like, or something like that, too gassy. But the point of the bloating is to continue being bloated for a long period of time with anything that you can try, and it doesn't help. For instance, when I got diagnosed, I was very into fitness and I was going to the gym constantly and I was doing my thing and stuff. And I was eating good and I continually felt bloated. And when I went to the doctor, they did a colonoscopy and endoscopy. And they said I had IBS, and that was my bloatiness. So they kind of gave me Prevacid, I think it was, and called it a day. And unfortunately, the bloating never went away. So that's my point: is the persistence of these symptoms that you have to be familiar with. Meaning, like, another one is unusual weight gain. If you've always been fit and then all of a sudden gain 20 pounds rapidly, then that's something to talk to your doctor about. Abdominal pain. Now, with ovarian cancer, you'll get a lot of pain in the ovaries, especially when you get your menstrual cycle. Now, even for kids who are young, and we know that there's young kids getting this horrible disease. No, they do not have their cycle, but women, girls, I mean, still have their ovaries. So it's still processing and developing when you're young. So the pain is still there, the abdominal pain is still there. Unfortunately, doctors still believe that in young girls, ovarian cancer cannot persist, cannot be there, and we need to take that stigma away. Another thing would be constipation, back pain. Yes, I wrote things down because I tend to forget a lot of the things. And even though I know them in my mind, sometimes when I'm speaking, it's hard for me to come across what I'm talking about. So your pain, ladies, the pain when you have intercourse, that pain, you'll know the difference. As a woman, you know the difference between a good pain and, of course, a excruciating pain in that area. So all these symptoms that we constantly talk about will only help you if you listen to your body, listen to your guts, listen to your instincts. Women, we have those instincts that something is wrong. Even as a child, you can say, Mom, I don't feel well, something's wrong. Be open with your girls as parents, as mothers, to have that communication when it's in reference to your ovaries and uterus and all that stuff. I think it's time where we are not afraid to speak about it. The myth of talking about women's body parts are over with, I believe. And the more we talk to our girls, the more they know, and every generation will know more and more. And that's how we will be able to get in front of this ovarian cancer. That is the only way, is by knowing, by educating yourself, by talking. Don't be afraid to talk about it. And again, when you're at the doctor, you tell the doctor, look, this has been going on for months now. Keep a log of your body when you see that there's something wrong. The date, the time, what you ate, what are you feeling? And when you go to the doctor, you have proof. Look, this has been going on and this needs to be checked out. I don't know what it is, but I know it's a lot of stuff and it may not be ovarian cancer. But it's important that you are not afraid to speak to your doctor. He's a human being, or she, just like us. And the myth or the thing, the scareness of talking to your doctor should not be there anymore. You should be proud and that you know the stuff, that you've educated yourself. And you persist with the doctor again, saying, this is what I have: bloating, unusual weight gain, sleepless nights, more time, you or urinate more time because the pressure is down there on your bladder. So you're going to go to the bathroom more time. Abdominal pain, fatigue. Oh, please. Every woman has fatigue, right? That's what the doctor's going to say. No. You will know the difference between this fatigue and your regular everyday fatigue. And don't push it back and say, oh, I'm just tired. Oh, I have so much to do. No. Listen to your body. Make sure that you keep that log in and put down every little detail. Do it on your phone. Make up a journal on your phone and write everything down. You don't have the time. I'm sure you have 2 minutes when you're on the train, when you're waiting for your kids to be picked up, when you're having your morning coffee. It would take literally like 2 minutes, if that. Indigestion, feeling full quick. Of course, when you eat, your stomach, your abdomen is going to expand. And if there's anything there, it's going to hurt and you're going to feel full. So remember that. Your back pain, lower back. If you have anything going on down there, the pressure again is going to be there. We talked about pain with the intercourse and constipation. Unfortunately, it all involves that area. So you have to, like I said, be very persistent of what's going on in your body, and continue talking to your doctors. And don't be afraid to talk to other women about it. We women, I always say, should stick together. We tend to push aside and all that stuff, but women need to stick together. It's not about jealousy. It's not about anything like that. We have a bond that sometimes most men don't. It's important to talk to one another and to be concerned. And I think nowadays we have a lack of empathy, and it's important that we get that back. I'll be back maybe next week to talk about more on ovarian cancer. Yes, it is September, and I will be on and talking. Have a great day, everyone. Love you. Bye.